Welcome back to Facial Aesthetics Unmasked. We are Utah Facial Plastics. I'm Dr. Thompson with my partners, Dr. Henstrom and Dr. Manning. And we're continuing our discussion of hair transplantation today. And today we want to talk about the different techniques we use to harvest the hair. So in other words, taking the hair from the donor side, which is usually the back of the head. And there's two primary techniques that we use for that. And maybe you can introduce us to those, Dr. Henstrom.
Yeah, there's the FUT method, commonly referred to as the strip method, where we remove a strip of hair from the back of the scalp and we close that incision and we use the hair follicles from that strip of hair, versus an FUE, which is a follicular unit extraction method, where on the day of the procedure, we're going to shave the hair on the sides and the back of the head really short so that we can remove one hair follicle at a time. So those are the two basic ways that we can get hair from the back of the scalp that we want to use up on the top of the scalp to cover the balding areas.
So Dr. Manning, maybe talk to us about why we would choose one over the other, what the advantages and disadvantages are.
So I think with the FUT method, if you are going to wear your hair 3/8 of an inch or
longer, and the FUT is that strip method that he mentioned.
It will tend to cover pretty well. And so people who don't want to shave their head are a good match for an FUT. So for women, most of the time we're doing an FUT because you just shave the strip of hair and skin that you're going to be extracting, and then that gets closed, and the hair above and below the incision covers that incision line from day one. So that's a definite advantage of that strip method. The other thing with the strip method is, depending on the laxity of the scalp, the density of the patient, sometimes you can get a lot of hair from a strip method, and you can get it quickly. The harvest takes a half hour, 45 minutes, as opposed to a couple of hours for a very large session of FUE. And then one other instance where it's helpful is if you've already had an FUT, if you've already had a strip method in the past, if you're doing a revision surgery, you can go back in through the incision line, so you're not making a new scar in a lot of cases, and take out a little bit more hair and add a little bit more volume to somebody who's already been transplanted. So those are the people who are good candidates for an FUT. I'd say I'm doing that pretty regularly. It's maybe like 30 or 40% of the hair transplants that I'm doing.
Yeah, for me, I'd say it's almost half and half. I feel like online, the traditional method, the FUT or the strip method, maybe doesn't get the credit that it's due. And there's always this discussion of the scar. And generally speaking, if you choose the patient well, the scar can be very inconspicuous. And it is a big advantage that you can't see what was done right from the get-go, because we really don't have to shave any hair. The only other advantage, or I guess point to consider, is typically the FUT or the strip method is yet generally a little bit less expensive because it's a little bit less labor intensive and equipment intensive. Any other advantages or disadvantages?
Well, no, the one thing I was going to point out, though, is that, there's a lot of places out there that advertise, but they only advertise for the FUE method. That's all they do. They don't offer a strip method for whatever reason. And sometimes it's because they have a machinery and so forth that they can only do an FUE method. And in some patients, especially like in women, like Dr. Manning said, the FUE method might not be appropriate, and doing the strip procedure is much more appropriate. And I agree with you. It's about a 50-50 mix in my patients where we're doing a strip versus an FUE. But there's also the instances. I had a case just the other day where we combined the two. This was a patient who had had a couple of previous strip procedures. We weren't sure how much laxity with his skin we were going to be able to get, how much of the strip we'd be able to remove. We ended up getting a good strip out of that, but we also shaved the sides and the back of the hair, and we supplemented the strip procedure with some FUE, which he had never had. So we weren't worried at that point in time about over-harvesting some of these other areas where the strip hadn't been removed, because he hadn't had any hair removed from that area. So we used both a combination of the strip and follicular unit extraction to get as much hair as we could to benefit that patient.
Great point. I feel like if wherever you're going, whoever you're consulting with isn't comfortable with both procedures, then you're probably not getting the whole picture. And, sometimes it is a combination. Sometimes one is clearly better than the other. One other question that I have, Dr. Manning, that patients ask me a lot is, okay, so you're going to remove this hair and then it's going to grow back in the back of my head, right?
Yeah, that's not the case. It's kind of like getting a tree from the nursery. The tree's gone, but you're relying on the hairs around that incision line to grow back in around the incision or around the site where it's taken in the case of FUE, and camouflage that incision line. So that's the thing about selecting the right patient. You want to make sure that you don't take out too much to where you end up with a wide scar, and a wide scar is caused by taking out too much and then having that skin when you close it be under tension. So there is an art, I think, to selecting these patients and performing the surgery. And there's one more thing I was going to ask you guys about. So I also think another really nice indication for an FUT is maybe in someone who has had a lot of regression or a lot of loss into their donor area. Do you guys use that technique for those patients?
Yeah, a lot of times when they're thinning in the crown, it can just really proceed pretty deep back onto the back of the head, and there's really not a lot of surface area to work with, and sometimes an FUT is really good in that case. But yeah, that hair doesn't grow back. We've moved it from one spot to another, and so that's why I think it's really important that you consult with someone who's comfortable with all the techniques and can get you the best possible outcome and the most hair from your donor area. So that kind of covers the two techniques.
I think we just covered FUT. I think we can talk a little bit more about FUE.
Okay, go ahead.
So, one of the differences with FUE, like was mentioned earlier by Dr. Henstrom, we have to shave the head up, about to where you're going to start placing the hair. So, obviously not ideal for women, with some few exceptions, I guess, if you're just harvesting a small number of grafts from the lower portion of the neck. But the nice thing about it is when you harvest hairs with an FUE method, you're using about a 1 millimeter punch, and you're punching out each follicular unit individually, and you're dispersing, say, 2,000 or 3,000 grafts over a large area over the back of the scalp. And each site where you take out a follicular unit, a little group of hairs, it heals as a little white fleck. And usually, even when you shave that hair, it's very hard to find that. And so that can be a really nice approach for people who are going to wear their hair short, who are going to have kind of a fade type cut. Do you guys have limitations when you're looking at somebody and you're kind of chatting through like limitations of an FUE? Is there anything that you guys think about?
Yeah, I mean, I'm really glad you brought that up because we talked very basically about what the two different procedures are, but the FUE does leave a scar. It leaves a little pinpoint scar where that hair follicle is extracted from. And I just talk to the patients. I say, if you like to wear your hair really short, there's a higher possibility that scar is going to be visible if we do a strip procedure. And so in those cases, I tend to just encourage them to do an FUE procedure. But if they went completely down to a 0, you might be able to see some little white marks on the back of the skin. It's on the head. It's not scarless surgery, but it's definitely less visible than a line.
I haven't had any patients complain of that. I even brought it up, and I've shown some of my patients, and patients with slightly darker skin, our Hispanic and Latino populations, you might see that a little easier. Well, I've had plenty of those patients, and they like the fade, and I'll show them these little teeny white bumps or scars, little flecks, as you said, bother you, and they say, I don't even notice them. So it's hard to notice, but they're there. People need to be aware that they're going to be there.
How do you counsel patients with really curly hair when they're talking about an FUE? Saying maybe like patients of African American descent or Samoan patients. What are your thoughts with that?
Yeah, for those patients, generally speaking, underneath the skin, the hair follicle may have a little bit of a curved shape to it. The root may not be straight down into the skin like it is with a typical straight-haired patient. And so with those patients, sometimes we have to use a little wider punch to make sure we're not having damage to the hair follicles, and that may result in a little bit more of a visible scar or a little visible dot in those areas.
Yeah, the nice thing is those patients are great candidates. When you harvest good hair and you transplant them, that curliness to the hair does even a better job covering the scalp than straight hair. So people who do have curly hair are great candidates for transplant, but there's steps that we take and our team will take to ensure a very low rate of transection and other issues that might harm the hair that we're harvesting. It's very important to get that done right so those transplanted hairs have the best chance of survival.
And I would say that even there are some patients where their hair curls so much and so unpredictably that even a large punch might risk the hairs too much, in which case they would be a good candidate for an FUT.
Yeah.
And, you know, an FUT you can basically use on everybody. So regardless of how curly your hair is, you know, you can always get a strip out and get nice, healthy grafts out of that. So I think it's another nice reason to have that technique in your back pocket.
Yeah, exactly. It's just another reason you want to be able to have all the options available when you have your consultation. Any other points or topics we need to touch on this?
Do you want to talk about graft size? So, you know, what's kind of the maximum that you guys are comfortable doing, and how do you determine that, you know, our maximum number of grafts?
Yeah, because
donor number.
Yeah, you may see on the internet, oh, this person had 5,000 grafts, or this person had, you know, a mega session is sometimes what sometimes those are overseas ads. Sometimes you see those sorts of things online.
Yeah, you got to be careful. You don't want to. We mentioned already over harvesting. That's a possibility for some people. And if they come in with slightly less dense hair, and you go for a big mega session, you might actually make the back of their hair look worse and less dense. So a part of what we're going to assess when we look at patients is, what is the density of your hair? How much can we afford to remove from a square centimeter without it looking any different? But our ranges, you know, we're going to do smaller cases, which may include, you know, eyebrows and other things, which may only take a few hundred donors, donated hair follicles, up to 2,500 to 3,000 donated hair follicles. And mind you, each of those hair follicles can grow 1, 2, 3, or even sometimes 4 hairs out of it. So if you're donating 2,000 hairs, you may get 2,500 to 2,800 hairs growing out of those hair follicles, so for better coverage. So it's a matter of just counseling with the patient, looking at the area that needs to be covered, deciding what density we want to have for that coverage, and going from there.
And 4,000 or 5,000 might sound really great, but the reality of doing that procedure and doing it safely and having a high success rate of survival of those grafts goes down. The bigger the case gets, when you start to get, you sort of reach a limit of sort of diminishing returns. And so we would rather do 2,000-3,000 cases than a 6,000 case, because we just know you're going to be uncomfortable. You're not going to have a good outcome if we push the envelope too much.
I totally agree.
Yeah, the viability of those hair follicles are going to greatly diminish when you get into those high numbers. You are much better off and will have a much better result if you split that up into a couple sessions, and long term that'll be much better for you.
The people I've seen who have been over harvested like that, what they've done, what they've had done is they have had to extend the donor area up into the area where you're already losing hair, and they've grabbed those hairs that are programmed to fall out up into the crown area, so they don't last very long. And then when they do fall out, you're even thinner in the crown area where they were harvested. And so I think that there are a lot of reasons why it's just, you know, you have to be really, really cautious and do the ethical thing, which is to limit yourself, even though you maybe could do more. Is it in the patient's best interest? I don't think it always is.
Yeah. Well, I think that wraps it up for this week's discussion on hair donor, whether it's an FUT strip method versus an FUE method. Thank you all for joining us. If you have any questions, please feel free to visit our website at Utah Hair MD or UtahFacialPlastics.com. Get information there. Give us a call. Come in and have a consultation with any one of us. We'd be happy to talk with you and the options that best work for you.